Hey guys, so I'm actually gonna be talking over this video because there are some things that I did want to mention, but this is just me doing a quick tutorial video on IV insertion. So right there I'm showing you like the kit that I use at work that has some of the materials in that I will use for the IV. So in it, so that right there is our little tape. It's like a Tegaderm almost. It helps secure the IV once you put it in. Then you have your ChloraPrep, which is a cleansing wipe that you use for the skin to make sure you get all the germs off. Right there you have your tourniquet that you would tie around the patient's extreme or arm or hand. You got some gauze. And then you have your sticky wipe. And all it does is it helps secure the Tegaderm to the skin once you have your IV in place. You have some tape. And so right there, I'm just explaining how we like to do hand hygiene, warm soap and water. You know, you have to do it for 20 seconds. And then I always go in the patient's room and overlay myself with some hand sanitizer as well, just so that the patient and the family member knows that I am also doing hand hygiene as well. And then I will grab my gloves that I'm going to use. Always use gloves, guys. Universal precautions when doing IV insertion sites. Alright, right there I have my patient's hand. That's where we're going to go. For the video purposes, I did not take the IV catheter out, but that's just to show you how the technique is done. Right there, I'm tying my tourniquet around the patient's wrist because I am going to go in her hand. And right there, what you're doing is you're feeling for your veins. Be careful because sometimes veins do pop up, but they have valves in them, so it makes the IV harder to advance. Once you tie your tourniquet around, just make sure that you can feel for your IV again before guys you clean. Once you clean, you don't really want to be touching the skin. Make sure that you know exactly where you're going. You have a good anchor. This is an adult patient, so it's a lot easier for her to be still while I am getting ready to insert the IV. With kids, it's a little bit different. Sometimes you have to kind of reinforce them being still. Sometimes parents are a great help, sometimes they're not. But always take a partner if you're doing pediatric patients. Definitely want to take 2 people so that you have great success at getting the IV in. Right there, making sure that we have a good anchor. That's our ChloraPrep wipe that you're going to use to touch the or clean the skin. Excuse me. Remember, once you start cleaning, you do not want to touch the skin again. So you clean about 5 to 10 seconds.